Hi, I'm Dr. Joanne Lynn, Director of the Center for Elder Care and Advanced Illness at Altarum Institute. And I'm here today to talk with you about how to understand your care system so as to be effective in improving care transitions. You have to understand your system across multiple providers and the community providers as much as the medical care providers. People come back in the hospital as much because they didn't have transportation or their housing was inadequate, or their caregiver wasn't supported well, as much as having their medications wrong. So you need to really understand what are the main drivers in your own system. How can you know that? First, talk to some of the people at the critical points in your system. Who are they? Try the emergency room, the people who see the folks who bounce back and whose families come in saying, oh, we had no idea that he was taking both one drug and another drug and they're really the same drug. We had no idea that we needed to see the doctor right away. Also talk with nursing homes. They're a place where lots of very sick, very frail people live. And if they're bouncing people back to the hospital quickly, you may really need to focus on that. The Area Agency on Aging may have some substantial insights about what things are really not available enough in the community, what kinds of things are hard to get. You might talk with the safety net providers, people who take care of the very poor, the homeless. That may be a big contributor to your workload. You may also then, you really should, go look at some patients who bounce back fast. Look at their records. Were they prepared? Is there evidence that they were talked with? Is there evidence that the medications were made clear? Was there a real plan of care and was it documented? Are you sure it went to the patient and family? Does the downstream provider have enough preparation? Look at the records, then talk with some of those people. Talk with the patients or family. Talk with the downstream providers. If you set up to do this on a regular basis, maybe once a month, do 5 or 6 patients, then you will have a way to monitor whether you're actually improving things. It's very important that you not fix something that isn't a major problem in your setting and do prioritize the things that really are going wrong for lots of people over and over again. If you fix those things, you'll build the will, you'll build the enthusiasm, you'll build everybody's willingness to step in and try to make this work right. So spend a little time, spend a little effort, get to understand your system.